Thank you so much for taking a couple minutes of your day to join us. My name is Hope Plack, and I'm here at the Center for Natural Healthcare in Red Wing, Minnesota with Dr. Joseph Sievely. And today we are talking about COPD and natural treatment. So just to jump right in, Dr. Joe, can you tell us what is COPD?
Hope, COPD is a umbrella term to describe a number of different health conditions of the lung, which include chronic bronchitis, emphysema, pulmonary fibrosis, idiopathic pulmonary fibrosis, as well as sarcoidosis. Asthma is also a lung condition, but it has been classified more as autoimmune, not falling under necessarily the category of chronic obstructive pulmonary disease.
And Dr. Joe, how many people are affected by COPD that is estimated?
So, according to estimates, the American Lung Foundation, approximately 14 million people suffer from this serious form of lung disease, and many more are truly undiagnosed.
And how would someone know if they have something like COPD or one of these other lung conditions?
So the primary symptoms of COPD is tightness in the chest, chronic cough, wheezing, and difficulty with movement, shortness of breath, that type of thing. Especially when it's happening on an ongoing basis. It's really important to take the time to be evaluated and check to see if there is some type of more serious lung condition developing.
And Dr. Joe, how do you evaluate patients who come in with a concern either of COPD or maybe have been officially diagnosed by their medical doctor? How do you evaluate them in your office?
So there's a number of steps that we ask the patient to take to be properly evaluated and assessed. One is they answer health questionnaires through our website and to get a thorough understanding of what their health challenges are and the types of symptoms they're experiencing. And then they come in for a comprehensive history, hope, and examination, which the examination includes spirometry testing, which is the typical lung test that when a person goes to a pulmonologist, that will be done blowing into a machine, evaluating the vital capacity of the lungs' ability to exhale air. And then we'll also do a 6-minute walk test and a oxygen saturation test to see how well their tissues are being saturated with oxygen, because these conditions dramatically interfere with oxygen and carbon dioxide exchange in the lungs. So we want to get a benchmark starting point to know kind of where the patient is coming from. After that initial chiropractic, neurological, orthopedic assessment, lung evaluation, then laboratory testing is typically done also. The lab testing is important because many of these people come in with other underlying conditions that contribute to why they're not breathing well. For instance, many people have prediabetes and diabetes. So if a person isn't utilizing their blood sugar properly, they cannot properly get the fuel to their lung tissue for the repair of that tissue. So it's very important that these underlying conditions also be evaluated so the person can really be well whole body with a special emphasis on their breathing. Very, very important.
And so, Dr. Joe, let's say someone came into the office, they had their initial evaluation. From there, where would you take them with treatment? What would it look like?
So treatment can consist of a variety of things. The food sensitivity testing is done, so we find out what foods they're sensitive and reactive to that may be creating excess histamine and inflammatory reaction in their lung tissue, again interfering with their breathing. So the person is given a specific diet plan, food sensitivity, 4-day rotation, elimination diet plan based on their lab testing to follow very carefully. That's a critical portion of their treatment. In addition to that, we also do nutritional testing, hope to identify any weaknesses that the person's had in their diet prior to coming in. And many people have multiple deficiencies of antioxidant and specific nutrients, so they'll be placed on a nutritional program to begin supporting that area of weakness for their lung tissue. And then finally, the other part of the nutritional portion of the treatment includes traditional Chinese medicine using specific products and protocol that have been developed over a number of years to help regenerate the lung tissue, to break up the scarring, to help improve the oxygen and carbon dioxide exchange of the lungs so a person can start breathing more freely, more easily. We use laboratory products, Soup A, B, LC Balancer, Clear Lung, and a variety of other products that help to support and really jumpstart that regenerative process in the lung tissue.
And Dr. Sievely, I'm sure at this point the listeners are wondering, how long does something like this typically take?
To recover or
to
begin?
recover.
Yeah,
And
so
to begin healing.
sure. The healing process, again, is all dependent on how severe the person's condition was when they came. Many people come carrying oxygen. They're very compromised with their lung health. So they have to be more patient, hope, in that process of recovery. But on average, depending on the severity, again, these are all just generalizations. People have to be careful about generalizations, but where a person starts to feel better, typically it's 3 months, 4 months. They can start to experience changes, and sometimes it can take 8, 10, 12 months, again, depending on the severity of their condition.
But like you said, you're not just treating specifically the lung and maybe putting a Band-Aid on it, but you're looking at the body as a whole functioning unit and trying to address other things that might be contributing. And I'm sure depending on what's all going on, it really varies.
And it does vary, and those other things can interfere with their lung recovery, and that's why we must deal with a hypothyroid condition or a liver that's not functioning properly with elevated liver enzymes. So it's truly a whole body approach to healing.
Awesome. Well, Dr. Joe, thank you so much for sharing such valuable information with us today. And we want to thank you for taking a couple minutes of your day to listen in. If you have additional questions, we'd love to try to answer those for you. You can give us a call at 651-388-1211, or you can reach us online at www.centerfornaturalhealthcareredwing.com. We hope you enjoyed this video, and we hope you have a beautiful day.